Hey, this is Dr. Kid again. Listen, I'm so glad to be with you this Monday evening at 6 p.m. We're running just a little bit behind time here because of some technical difficulties. But we're gonna overcome all the technical difficulties that we can that people throw at us or the old devil throw at us. Okay, so we're good. But I'm just so glad that you stuck in there with me until we got started. It's the shake up, of course, and you know what it is. Nothing is the same when you shake it up. Everything is the same when you just leave it alone. And things tend to be the same continuously, but we shake it up so that we can get a different perspective of the same thing. And when you do that, you begin to understand that we don't know everything we know about everything that we think we know. Ooh, did I say that? Okay, well, fine. That's what it is. So the shake up, we're here for you to see life in a different way, okay? And because we're running just a little bit behind time this season, I'm not going to take a whole lot of time. But here's what I'd like you to do. I'd like for you to do it. If you'd like to be a part of this show, we'd like for you to email drkidspeaks@gmail.com, and we will get you on the program. We'd like to have you on the camera, of course, but if you would rather be off camera, we're good with that. Okay, drkidspeaks@gmail.com. And then what else do we want you to do? We would want you to like, follow, share, and subscribe. Like, follow, share, subscribe. This is the lifeblood of this and all podcasts. There are a lot of really good podcasts out there. So I'm not trying to do this just for myself. There are a lot of good people out there with a lot of great information, okay? So please like, follow, share, and subscribe to all of these good people. Now you got to be discreet. Some stuff may be questionable, but when you find a good one, take care of them, okay? All right, enough said. This evening we have a wonderful guest. Wonderful guest. And I'm going to bring her on right now. And as always, oh, look at that smile, man. That smile makes my life looks dark. What is this? Where you get that smile from? Oh, mercy. Can where am I hearing you? There you go. There you go.
Yeah, you hear me now.
I can hear you now, man. I was about to say that, with that smile, man, I can put my lights out and still have plenty of lights inside.
Good to be here. Glad to be here. Thank you.
Listen, Dr. D, it's good to see you. Good to have you here. Listen, just go ahead and introduce yourself, and then we're going to get right into this. We have some folks that are online just waiting to just hear all the nuggets and the great stuff that you got for us tonight when we open this thing up, okay? So welcome, and go right ahead and introduce yourself, however you want to introduce yourself, okay?
Awesome. Thank you. Well, I am a licensed clinical psychologist. Since we're here talking about trauma, I will say that I am a trauma specialist. I have been in this field for a while now. Oh my goodness. Sometimes when I think and I count the years, I'm like, am I old enough to say that I've been in this field for 20 years? But I have been, and I have been doing this for quite some time, and I enjoy what I do. I love what I do. One of the main things that I want people to have as a takeaway is that trauma recovery is possible. Healing is possible.
All right. Licensed clinical psycho. Now that scares me right there. Okay. It scares me. But listen, I know you got something that you want to talk about tonight, but there is a question that I have for you. We hear a lot about traumas, right? We hear a lot about traumas, and there are different definitions of trauma. As a licensed clinical psychologist, can you define trauma? Not necessarily across the broadest spectrum, because a whole lot of people got a whole lot of things to say. How do you define it based on the kind of a work that you do?
Yes, I'm so glad that you mentioned that based on the work that I do,
Yeah.
because there are a lot of definitions of trauma.
Yeah.
And I think that, if you look it up in the dictionary, it will tell you any distressing experience. So anytime you have a distressing experience, but I think it's more than that. It's more than just a distressing experience. So one of the things that I like to think about when I think about trauma is not just that it's a distressing experience, but that there is not an equal and immediately available amount of healing for the amount of trauma, for the amount of the distress that you're experiencing at the time. And also that it changes you in some way. So I give an example sometimes,
Go
uh,
ahead.
prick your finger with a pin, whether it's, to check your blood sugar or your iron levels. That causes some level of trauma. You are tearing the skin, you are going into the blood vessels, you are bleeding. So it causes some measure of trauma, but there is a pretty immediate and immediately available amount of healing for you. Usually, unless you have a pre-existing condition, you stop bleeding, the pain goes away. It's not long lasting. So we wouldn't necessarily call that trauma. Although it is painful, we wouldn't necessarily call it trauma. However, when this whole pandemic thing started, I got all these little kitchen cooking supplies, and I just knew I would be cooking every single day. No, and I got a kitchen chopper thing, and I went to push the blade down in, and I just overshot my hand a little bit, and I slapped my hand directly down on the blade. Well, when I brought my hand backward, like I recoiled from the pain of it, I could see down into my flesh. I could see my bone. I could see the ligaments that should have been attached.
My.
That took several months to heal. And not only did it take several months to heal, there just was not an immediate amount of healing available for the amount of trauma that my finger experienced. It was different than a pinprick, right? And then not only did it not heal for a while, it took some time. I was changed just a little bit because now my finger is still a little stiff. Right now, as I pull it, I can feel that it's a little more stiff than it used to be. I have a little post-traumatic arthritis, I believe. I've diagnosed myself with that. There in that.
You're allowed to do that.
Yeah, well, thank you. But it just doesn't bend the way that it used to. It doesn't move the way that it used to. There's a little bit of stiffness still in the joint. So it changed me in some way. And so I would say trauma is anytime you have a distressing experience that there is not an immediate and equal amount of healing available, and it changes you in some way.
Yes, it does change you now. So thank you for that. It does change you in some way. The question here is, what is your resilience like in order to adjust to the change? And of course, we're going to talk about the different types of traumas in a moment, but there is this resilience and this want to, you can lay down and allow the injury to, to basically control you. But can you talk about the resilience, the ability to move past that trauma?
Yeah. And, I think that we each have different levels of resilience. Resilience is not equal across the board. Remember, I even mentioned when I said, when you have a pinprick, if you don't have any pre-existing conditions, well, some people have pre-existing conditions, so that a pinprick can be traumatic. Especially if you're talking about someone who's diabetic and they have several pinpricks, and then they already have difficulty with healing, and you have several pinpricks, you might have start getting some pain in those areas, or loss of even sensation in those areas, right? So resilience really has a lot to do with what you've been through already. And then not just what you've been through already, but what is the foundation that you have for healing? Like, do you have the tools that you need to be able to heal? Do you have the community and the support around you that you need to be able to heal well?
Okay, wonderful. So now we're talking about there are different kinds of trauma, biopsychosocial, traumas, So let's take one of those, like you're talking about the biological, being traumatized biologically here, and when one person is traumatized in a community, a family, and that person has a specific role in that community or family, the inability for that person to fulfill their role, can that bring some degree of trauma based on the dependency that other people may have on them?
Yes,
You address
absolutely.
that, please.
Yeah, absolutely. And so you're talking about what happens when somebody who is foundational to their family, to their community,
Right.
to whoever it is that they are also connected to, what happens when they experience a trauma? What happens when they are perhaps not able to fulfill the role that they were previously fulfilling? What happens when mom gets cancer? What happens when dad dies? What happens when there is some type of trauma that a family unit or a community experiences altogether? And really, a lot of us have to deal with that because trauma doesn't just sit in its own little box. It just doesn't stay as compartmentalized as we perhaps would like it to. So what happens? Well, there is shifting that goes on. People do have to pick up different roles, perhaps, and it does impact everyone around. And it doesn't just impact everyone around just because, oh, we see that this person isn't able to complete their role anymore. It impacts us to the point that your genetic material is stamped with that experience, so that you pass down genetically to the next generation the traumatic things that you've experienced. But there's good news in that. The thing that you said before, resilience is also passed down. Healing is also passed down. Wholeness and good examples and good responses to things. Those things are also passed down. So it's not just trauma that's passed down. It's not just trauma that impacts our community. Resilience impacts our community as well. Healing impacts our community as well.
Yes, it does. And so the unavailability of one person because of a trauma can traumatize a person who's dependent on that person who's no longer available, right?
Absolutely. Yeah.
Okay. All right. So we have different levels and causes and reasons for traumas. Okay. So we can spend all this time talking about how trauma happens, but how, based on the different types of trauma, the traumatic experiences that people will go through, they come to you now as a clinical psychologist, and what are some of the things they want to know right up front? They're going through this trauma. What do they want from you, Dr. D? Come on, what do they want? They want Tylenol from you.
I will tell you, a lot of people want the same thing that I probably wanted at some point in trauma recovery and my own recovery from my own traumatic experiences, which is pretty immediate healing. What can I do to fix whatever is going on? I'm in a group where I saw someone post the other day about their child having some difficulties, and they're like, and don't say therapy because they're already in therapy. I need something right now. I need something more immediate. And the reality is that's the whole point of what I said trauma is, right? There is not always an immediate amount of healing or an equal amount of healing for the given stressor. So it does take time. Trauma heals over time. Pain heals over time. Distress heals over time. And so I think what people often want is immediate. But what really happens is lifelong. It is lifelong. And I think that in some ways that can feel a little distressing. I think that the idea of, oh my goodness, I'm going to be healing for the rest of my life. I would like to just say I'm healed in past tense and it's done. It's over with. But the reality is we will be healing for the rest of our lives. And that is a gift. That is a gift because the opposite would be that we wouldn't be healing for the rest of our lives. And I think that I would prefer this than the alternative. There's no magic pill for trauma, somebody says. I see that.
No magic. Oh, come on. I was looking for that magic. I was going to stop by the store on my way home to see if I can get
find the magic pill for trauma. Yeah. But and it's so interesting. So even as they say, there's no magic pill for trauma, there is resilience, like I said, right? So there is the, when we talk about bouncing back, I don't think we always talk about the fact that, yes, we might bounce back, but that doesn't mean that you'll never be triggered again. That doesn't mean that you'll never experience pain again. It doesn't mean that you'll never experience harm again or be reminded of the traumatic experiences again. It just means we want to find a way to work through the things that we have experienced. And the thing that is the quote unquote magic pill is connection. There are ways to actually address this, but it's connection, it's safety, it's feeling at home within yourself and within your surroundings. Those are the ways that we address trauma. Those are the magic pills for trauma. It's not going to be like an aspirin.
Right. So we're talking about when you say connection with the self. So that could there be like at least a couple of levels of different types of connection with the self, and the self's ability to be connected with the larger community, to walk through the trauma?
Yeah, both are so very important. Connection with the larger community and connection with ourselves, because As you connect with yourself, that makes you a little more available to connect with your community. I think it's a very difficult task to try to connect with your community and you feel so disconnected from yourself. I think that it's really a difficult task as well to only seek the answers within yourself, when the reality is the way that we are usually traumatized, most trauma is interpersonal. The way that we usually experience trauma is in an interpersonal setting. So the way that we usually will experience healing is also in an interpersonal setting. We need each other. We need community. We cannot try to heal just on our own. Something that Bell Hooks said years ago, and I think that it's been seared in my memory since the first time I read it. She said that healing is an act of communion. She said, rarely do we ever heal on our own. Mm-hmm. Healing is an act of communion.
Okay. So listen, Tracy said it isn't. Is anxiety a result of trauma? How would you answer that?
Not necessarily. So some people have anxiety and they don't have any recollection, at least, of trauma. Now, there are plenty of people who've been traumatized. They've experienced trauma and they don't have recollection of the traumatic experience either. But there are plenty of people who have anxiety and there is no known cause necessarily of the anxiety. One of the things that we know, though, about both anxiety and depression is that no matter where it comes from, whether it's from a traumatic experience, whether it's from loss, whether it's from genetics, you know, your aunts were depressed and your grandma was depressed and your mom is depressed. The women in your family just tend to be depressed, right? This has been passed down in some way. It doesn't matter where it comes from. It is maintained by our thoughts. There is some pattern that is being kept up where we are thinking ourselves into staying in this pattern, which is why I tell people, yes, treatment of choice for anxiety and depression is medication, but we want to combine that medication also with therapy, because you cannot really medicate your way out of bad thinking. It's kind of like how people say you can't train your way out of a bad diet. You can't really medicate your way out of bad thinking or out of a thought pattern that keeps you anxious. And so it's not always trauma, but can trauma result in anxiety or feeling anxious? Absolutely. It changes your threshold even for what you feel anxious about.
Yeah. Listen, ladies and gentlemen, we're talking with Dr. D. She is a clinical psychologist. She is an amazing resource person. Everybody needs to get in touch with her. Of course, we're going to put her contact information up there. But for now, I got her. So you just yeah, for now I got. Listen, Doc, I got this question here, though. You know, when we're talking about interpersonal connection with traumas. Is it possible for some person to blame themselves for the reason they were traumatized by somebody else? They said, well, I don't want to put it in your head. Go ahead and answer that question. They blame themselves. They hold themselves responsible for what happened.
Oh, absolutely. Absolutely. So I don't mind even sharing from a personal perspective. Okay. I blamed myself plenty for trauma that I experienced. And that was even after getting to the place where I'm here getting my doctorate in this thing. And still, I blamed myself for traumas that I experienced from some as young as infancy. I just said this, how could I blame me for that, right? And yet I still blamed myself for some of the traumatic things that I have experienced. So is that a normal thing? Quite honestly, it is. It's not abnormal. And I think that a part of that, we're just theorizing about this, right? But I think that a part of that is that we think that, well, listen, if I don't know who to blame, at least I could blame me. Because then I could change me. I could change something about the environment or something about what I do or something about, I won't take that same dark alley and I won't take that same cab ride. And we'll make sure that we try to do something differently so that we can blame ourselves and at least change that behavior. But the idea that it was not my fault, and not only was it not my fault, but I did not have control, which is a large part of trauma. We didn't have control over what happened to us. If we could have escaped it, we would have, right? Whether it's a car accident, whatever it might be, whether it was car accident, war, assault, whatever it might be, a large part of trauma is that we could not escape the terrible experience. So if we could start blaming ourselves, then at least we feel like, well, in the future, I could change something about that. I can make sure that I'm not in that same situation. But the reality is, life happens, and we can't prevent and avoid every single traumatic thing. The reality is that most people will experience trauma at some point in their lifetime. Yeah, at some
Now,
point in their lifetime.
yeah.
Yeah.
So how about, you know, I'm asking all these crazy questions, Doc. So just forgive me.
Okay, fine.
Listen. I don't know any better. Okay, is it possible? Is it possible for me to blame myself, because if I blame somebody else that I'm dependent on, they will abandon me. So I blame me. I take the responsibility for this, even though I'm hurting. My pain of what I'm going through here is less than if they abandon me, because of my dependency. Does anything like that work? Is that a possibility?
Yeah, absolutely. So people are going to try to survive however they can.
Okay.
We as human beings, there is one thing that the brain wants at the end of whatever interaction, whatever experience, whatever event it is that you are a part of. There is, one thing that the brain wants is survival. So at the end of that, the brain wants your neurons to be firing. That's just the brain cells to be working, the heart to be pumping, and the lungs to be breathing. However that happens, if we have to lie to ourselves and tell ourselves, you know what, it was my fault, I'll just make sure I don't do that again, or whatever it takes to survive this situation. Oh, I have to, play nice to this person. I have to, be docile so that they don't harm me more. Absolutely. Your brain will try to help you survive that situation. So if you were in a situation where you had to acquiesce to someone else's bad behaviors so that you could survive that situation, please know that that was normal and that does not make it your fault.
Okay. So let's kind of get down to something specific. This is October. We have Breast Cancer Month. We have what else do we have? Mental Health Month, and we have
Domestic violence awareness.
Domestic violence awareness. So let's talk about domestic violence here for a moment. And before we get into the trauma of domestic violence, can you tell us what domestic violence might look like? What is it? I don't know if you're going to give a definition and embellish the definition, because for different people, they may see it as different things. How can you help some people who may not be clear on what it is, and they're going through it and don't know they're going through it because of other reasons?
Yeah, when you say because of other reasons, just explain a little bit.
Other reasons, you know how it is in domestic relationship. In domestic relationship, one of the things that I've read is one of the key factors in domestic relationship is dependency. Dependency, not independency. Dependency or interdependency, or even some but dependency, the degree to which I do not have enough of me to take care of me. And so I farm out that part of myself to someone else that I believe is better than me, better in a lot of ways. So this is what I'm talking about, when I talk about this domestic violence piece, which is traumatizing. So, how would you kind of give a kind of a global picture of, what is this thing we call, and then we can get more specific about that.
Yeah. So usually when people are talking about domestic violence, they're talking about the intimate partner violence, right? So intimate partner abuse, where one partner, or perhaps either of the people in the relationship, are abusive towards each other. Well, when you talk about abuse, because that part needs to be defined just a little bit, right? Anytime you're talking about abuse, you're talking about power differentials. It is not always about size. It is not always about sex. It is not always about, like when I say sex, I'm talking about male versus female. It is simply about the power that this person holds when you're talking about abuse. So you're talking about in a partnered relationship or in some close, intimate relationship where somebody is abusing their power over the other person. That can be psychological. So it can be playing mental games with the person and like, making them think that they're quote unquote crazy, or that they, are, which some people, might talk about as gaslighting, making
Mhm.
them think that something is wrong with them when there is not, purposely trying to control them in some way. It could be financial. When you talk about dependency, that's one of the first things that pops in mind. But that's a huge thing that keeps people stuck in domestic violence relationships, is the financial abuse. So having all of the access to the finances and not the other person not having any of the access to the finances. Well, how can they get away from you if they wanted to? So the person not having the freedom to be able to leave should they want to. And of course, it can be physical as well. It can be sexual as well. There are several ways that power can be misused and abused against others. The typical way that we usually hear about is physical, right? We usually hear about physical abuse of a partner. But domestic violence takes many forms, and it can start. Oftentimes, it doesn't start as physical. It starts as psychological or emotional abuse. It starts as financial abuse. It starts as controlling the other person. So abusing your power in a way that controls the other person and does not allow them freedom.
And yeah, thank you. Thank you. Oh, stuff is good. I like you say about intimate partners, intimate partnership relationship. Now, some people's definition of intimacy is sex. So what if there is no sexual relationship? What if it's just uh, different levels of interpersonal connection? Maybe siblings, it may be friendship, it may be
Mhm.
platonic relationship. So when we talk about intimate, so how would somebody say, well, this is intimate, but this is not, since some people define intimacy as sex. So can you kind of take a look at that for us?
Yeah, so that might just be getting more into the semantics as far as the legal definition of it, right?
Okay.
For our intents and purposes, the reality is, if you are in when we say intimate, we just mean a close
Right.
relationship with someone.
Right.
And why that matters is that when you are in a close relationship with someone, there is an inherent expectation of safety. And that is the problem, really, when we think about trauma, is that you expected that you would be safe and you were not. That's the traumatizing part. You
Mhm.
thought that you would be safe when you went, and it doesn't even have to be with a partner. It could be, I thought I would be safe when I got on the roller coaster, and I wasn't, because it left the rails, right? I thought I would be safe when I got in the car. I wasn't, because we got into a devastating car accident. I thought I would be safe with this person that I married, and I wasn't, because they put their hands on me and beat me, right? Like, these are areas and experiences where we thought that we would be safe, and we're not. And so that's the whole point of discussing the intimacy part, is that I was close to this person. I allowed myself to be vulnerable. I allowed myself to open up to
Yeah.
this person. And those are also reasons why people tend to blame themselves, because it's like, you know what? I put myself in that situation. But the reality is, you are not to blame for someone else's bad behavior. You are not to blame for someone else misusing the power that they had in a situation and bringing you harm.
Right, absolutely, Doc. You're really laying it down this evening, and I thank you. I really do. I really do thank you. Listen, so what responsibility do I have for self-protection in trauma? Because some people may not define it as trauma, but however they define it, what responsibility would a person have, depending on what it is? Just generally, what responsibility they have.
And you said in preventing trauma?
Yeah, in either in preventing the trauma, discontinuing the trauma,
Responding to trauma.
yeah, yeah. So
Mhm.
what some people go into helplessness and hopelessness.
Mm.
They go into that. But can you tell us what responsibility we really have for self-care?
Okay, so first I'm going to say that those are normal responses as well. The helplessness and the hopelessness, those are normal responses. Judith Herman, who is her voice is a foremost authority on trauma recovery and care. She said something a long time ago. She said the traumatic syndromes that we have are really almost nothing more than our normal responses to abnormal situations. uh, Feeling helpless or feeling hopeless when you're placed in a situation, That is like all organisms. We have done this study several times, and we see that if you put, an animal on one side of the cage and you shock it and it can't get away and it can't get away and it can't get away, you can open the gate and it still will just sit there because it has learned to be helpless in this situation where it has been traumatized over and over and over again, and nobody has come to its aid, right? That's just, human behavior, animal behavior, just 101. We try to adapt to whatever the situation is so that at the end of the day, we're not expending our energy, running up our blood sugars and running up our, cortisol levels and all of these things for a situation that we can't even escape anyways. That's just our bodies trying to survive. So I will never place the onus of surviving or how you respond to trauma on just the individual. It will always be, how do we as a community respond to someone who's been traumatized? One of the examples that I love by Francis Weller, I think is his name. He wrote the book, The Wild Edge of Sorrow. And he talks about how he went into this village. He was visiting a village with a friend, and he went into the village and he saw a girl with a big scar across her face. And she was just dancing and she was so carefree that he wondered, what was her story? Like, what is it that she's so happy and joyful? And she doesn't seem to be, filled with shame or anything about this huge scar across her face. Well, her mother, when she was younger, had poured hot water on her because she was angry. So I think we can all agree that that is abusive. She harmed her because she was angry about something, and she caused this huge scar across her face. Well, the response was not just for this girl to try to figure out how she's going to heal, or somebody to take her to the hospital, and she just does this individual healing by going to her individual, physical therapies and, perhaps skin graft and those types of things. The village got together and gathered around her and reminded her that it was not her fault, that her mother should not have done that. Now, I don't know what happened to the mom, but I'm just talking about what happened to this child, why trauma and shame did not even stand a chance to continue to progress with her, right? Because the community got around and reminded her that it was not her fault. The community got around and affirmed her that she was beautiful, that there was nothing wrong with her, that she did not do anything to deserve the harm and the pain that she had experienced. And what a difference it makes when we as a community help people work through the traumatic experiences that they're having. Not just because, oh, this person, poor them, but because we all live on this planet Earth. We all have this one wild and precious life that we have to live. And we all know what it is to experience pain, to experience disappointment, to experience sorrow, to experience things that are harmful, whether we consider them traumatic or not. And most of us will experience something that we consider traumatic. So today it may be my turn. Tomorrow it may be yours. At some point, we have to, as a community, have a responsibility for how we respond to those who've been traumatized.
Wow. Thank you. Now, one of the things that that the literature speaks to, and just people, and your clients come in to see you, and other people go have clients, and so on and so forth. And there is this cultural overlay to what constitute trauma, and the normalizing of some behaviors which would in another culture be identified as trauma, but in one culture it is normalized. What do we say? When people travel, and like this country here, it is a very cosmopolitan country. It's just a mix, And sometimes some people will say, "Well, this is the way we were raised," and they may even say, "This is the way we were raised in our country," and this is the male-female relationship. The male dominance and the female, subjugating herself. How do you see any merit in taking a look at trauma from a cultural point of view? And if so, how would you kind of do that? If someone comes to you and if a different culture say, "Well, this is the way it is. This is the way it is," They were referred to you, but say by the courts, coercive treatment. They don't want to do that. They don't want to come, but they were told to come by somebody.
Yeah, I let people know what it is they're experiencing.
Oh.
Yeah. Can you see me again now?
See you again.
It's okay.
We're going to do the best we can.
Okay, super.
We're good.
Okay, super. All right. So I really allow people to define for themselves quite often and even a moment ago, I said, I think we can all right? I think we can all agree that this is traumatic, but not everyone is going to consider something traumatic just because you do. I will never forget an experience I had when I was in training years and years ago, where a gentleman that I was seeing was talking about some discipline that he experienced as a child. And it was to the point that he was bleeding. And I made what I thought was a very simple and very understood comment about it being abusive. And oh, did I get cussed out on that day? I didn't know what I was talking about, what the bleep I was talking about, and his parent loved him, and that's why he had that experience. And I didn't, and he didn't talk to me. I was at a facility that I was at for a few years actually, and he didn't talk to me for 6 months. And he couldn't remember why wasn't talking to me. So he ended up talking to me after a while. He said, let's just squash whatever this is that's going on. But I mean, he did not agree with my assessment of the situation. I learned then that I don't have to speak into someone else's situation and call a thing necessarily what a thing is, if that's not what they culturally might call it or refer to it. Now, I would think that anyone would call that abusive, but for him, it was not. And perhaps he wasn't in a space where he wanted to consider his parent in that way. I think that a lot of times, and this is something else that Bell Hooks talks about, a lot of times, and you kind of mentioned it earlier, if the person that we're dependent upon is quote unquote abusive, and I say quote unquote abusive, if they're abusive by even what I consider my standards of abuse, right? There's not an equal and immediate amount of healing for the distress or the harm that is being caused. If that is somebody that we have to depend upon, that is someone that we love and we care about, that is someone that we have perhaps idealized even in our minds, like say it's somebody who's passed away, it might take us a lot longer to realize or to come to the conclusion that what we experienced at the hands of this person was abusive. It might take a little longer to realize this person that was supposed to be loving me and caring for me was actually harming me, was actually taking advantage of me, which was actually not caring for my good when I thought that they were. So it can be very difficult to try to wrangle from people their ideas and their ideals of others. So I just really let people kind of label things as they need to. If you're coming to see me, it's probably for a reason. Right. So let's work from there. Let's just work for what the reason is that you're coming to see me. And sometimes I do have to tell people, and that's for lots of situations. You could just be at a job that's toxic or the situation at your job is toxic. And it's like, you can keep coming to see me and working on strategies, but it's hard to get well in a Petri dish. It's hard to not grow mold. The purpose of a Petri dish is to help grow those spores that are there. Right. And if you keep going back and forth and living in a Petri dish, then you might find that you have some mold here and there.
Mm-hmm. Absolutely. And just to kind of follow up on something you just said, I think it'll be hard for me to continue loving somebody if I believe that they're harming me, if what they're doing, they're harming me, So I get into this conflictual mode now. How can I say that this person that feed me and clothe me and do all these things, okay? How can I tell myself that they're harming me, because if I say they are, then I want to distance myself from them. I want to get away.
Yeah. Bell Hooks' exact comment was, love and abuse cannot coexist. And when I posted about that on Twitter, the tweet kind of took off, and there was one person who said, my mother, abused us, neglected us. We were taken into foster care. But I also recently had a conversation with my mother, and, she talked about a loving experience that she had with her mom. And she was like, so they can coexist. And I was just like, when we say coexist, we're talking about a time. We're talking about just the fact that we say coexist. We're talking about in the same time period, right? At the time that your mother was abusing you and neglecting you, that was not loving. And it's hard for us to acknowledge sometimes that this person who perhaps may be loving now, and maybe I have a loving relationship with them now, was abusive at the time that they were abusive. And at that time that they were abusive, they were not being loving towards me.
Okay. All right, Doc, we're not going to keep you much longer because I know you got to be so busy and your time is so precious.
My time is precious, but I'm not busy, and I'm grateful for that. I keep
But,
myself unbusy.
but listen, let's let's go now. Trauma and gender. Trauma and gender. The the literature and the statistics will say that males are more males are perpetrator, and that females are recipients of this. Now, it's a kind of a crazy question. Is that true, and does it really matter?
Um, is that true or does it matter? It matters in several ways and in several spheres, right? I mean, just when you think about how we conceptualize not just trauma, but a regular experience. So I say a regular experience. I mean, going to the store at night. I have realized that a lot of men don't even think twice about getting up at midnight to go grab something from the store. A lot of women think to themselves like, okay, who all is out there? Who's going to be able to watch out for me if somebody does attack me, right? Like these are just the thought process. And a lot of men don't even consider that. It's just, I needed to go grab something from the store, so I went to grab it from the store, right? So it matters in a lot of different ways. Does it matter as far as trauma recovery? Well, yeah, because we're not recovering in a bubble. We do have, society that is still, working in our minds and whatnot. So all of these situations still matter. But as far as when you're going into trauma recovery, the real thing that we need, that everyone needs when they've experienced something traumatic, is safety. The real thing that our nervous system needs to recover from traumatic experiences is safety. The real thing that we need, even when we get into a situation where we're concerned that we might be traumatized, is safety. So it's not just the sex of the person, but it's, do I feel safe around this person? Do I feel comfortable around this person? Is my nervous system at ease, or is it at attention? And for women, is it more likely for our nervous system to be at attention when we're around a group of men, as opposed to perhaps a group of women, people who look like us, sound like us, seem like us? Of course, we're going to be a little more at attention. So in several ways it matters, but when you're talking about trauma recovery, what do we all need? The same thing, safety.
Okay. Tracy Ray, is the need to be in control a result from previous experience of trauma?
So very similar to the anxiety question, not necessarily. Not necessarily. Just because you want to be in control doesn't mean that it resulted from a previous traumatic experience. But when you've had a traumatic experience, can it lead to you perhaps needing to be in control in more ways than you necessarily have to be in control? Because guess what? When you experience trauma, again, you weren't in control. That is the traumatizing aspect, is that you wanted to get away from it and you couldn't. That you wanted to survive this situation and you did, because you're here, right? But even though you survived it, there was something traumatizing about the situation. And if you could have gotten away from it, you would have. So what's most likely to flow from that? The next time that you're in a situation, you try to control it. That's, again, a normal, quote unquote, normal, typical reaction to trauma. But just because you're trying to control something doesn't mean that it's for sure because of the traumatic experience that you had. But that's lots of things. That's lots of things that we try to control when we don't have control over it. Our brains also want to figure out, I love what Dr. Andrew Huberman said. He says it's duration, path, and outcome. We want to know, how long is this going to last? What is the path that I'm going to take? And what is the ultimate outcome of whatever the situation, experience, circumstance, whatever it is, what is going to happen at the end of it, right? Trauma takes away our ability to predict all of those things. So am I more likely, when I've been traumatized, to try to control the situation? Yes, because I want to know the duration, path, and outcome. I want to know those things because at the end of this, I need my brain neurons to be firing, lungs to be breathing, heart to be pumping.
Woof. Mama. So here's a question. Is it possible to be self-traumatizing and normalize it that you're not traumatizing yourself for a variety of reasons?
So when you say self-traumatizing, I might have to have a definition of that, but I think that what you're talking about is keeping a cycle going.
Self-harm.
Self-harm.
Because I'm just trying to, just self-harming in a number of ways. Some people, because of their value for themselves or of themselves, self-harm. Some people say they traumatize themselves. They, even say people who make attempts at suicide, but they don't want to kill themselves, or they cut themselves in a way, and they're traumatizing themselves. And that's what I was talking about. Now, what are some of the things that would lead to that, even if you think that's traumatizing yourself, that's self-trauma.
Mm-hmm. Yeah, and I wouldn't necessarily call it self-trauma. I think that those are ways that people are coping with, perhaps whether it's trauma or something else distressing that they did not have all of the resources or other resources to be able to deal with that. I never try to take away people's resources or their current coping skills from them, unless it's something that is immediately or extremely dangerous to where, okay, if your coping skill is, making suicide attempts, then perhaps we need to work on that. Like, let's take that away and give you something else, right? But even for cutting, which is something that people do to cope with their situation, I would never want to take away somebody's coping skills until I can give them something else better, something else that works better for them. Because again, they are trying to survive. They're doing this more than likely as a result of trying to survive some situation. It's not always trauma. It's not always trauma, but they're trying to survive whatever it is that they're going through. So I want to know what is it that you are trying to survive? And how can we perhaps give you some different coping strategies to be able to deal with whatever it is that's so heavy for you, that you're cutting yourself, that you're harming yourself, that you're hurting yourself in some way?
Thank you. Listen, I really appreciate your time. You're special. You are so knowledgeable about a whole lot of things. You are a jewel and definitely a great resource to your circle of people that you work with. And I'm hoping that people that are listening on this, and when they replay it and you shoot it off to somebody else, share, that they will see you as a person that they can make contact with, just because you make such good sense, just really good sense to a lot of people without taking it to a level where just ordinary people cannot understand you. I think you've done an excellent job with that. So as we close it out, I'd just like to ask you, we're talking about trauma. This is Dr. D, an excellent person. She is a licensed clinical psychologist, very broad scope of knowledge, and very deep in her capacity to understand and to push her information out there. Very, very good. And so now, what would you like to leave us with? I want you to leave us with something that people can take away, and I'm going to put it this way, that when they wake up at 2:00 in the morning and their brain is awake, I want you to tell them something that is going to, as they think about it, change the trajectory of how they answer the question, who am I?
Of how they answer the question, who am I? Yes. Well, I think I will go back to what I said at the very beginning, which is that you can heal. Trauma recovery is possible. Healing is possible. Yes, you may be doing it for the rest of your life. That is a gift. It is a good thing to be healing for the rest of your life. And the reason that I say it's a good thing, I will just give a quick example. I have a scar on the side of my leg from where an abuser sliced my leg open. This is when I was 15 years old. So this is, oh my goodness, coming up on 30 years of this scar on the side.
You need to stop lying about your age, because I know what 30 and 15 looks like. Okay? And may have been a good mathematician, but listen, my cell phone. I can
Calculate.
take a calculator.
I'll just say that this scar is almost 30 years old. But when I touch on that scar,
Yeah.
it is still sensitive. It still has some sensitivity to it. When I touch to the left of it, feels just like the rest of my leg. When I touch to the right of it, feels just like the rest of my leg. When I touch directly on the scar, I can tell that there is something different there. But guess what? It's not as sensitive as it was 10 years ago, and it's not as sensitive as it was 10 years before that or 10 years before that. Healing has been happening over time. And I think that it's very important that we think about the language even that we use around healing. I was talking to a friend about the difference between being healed and being whole. And I would say that I am still healing, but I would say that I am whole. Even if we talk about the physical, the scar that is on the side of my leg, I would not say that my leg is broken. I would not say that it is wounded currently. It was wounded in the past, but my leg is whole. It is still healing. We are 30 years out from a trauma that I experienced, right? And it is still healing, and that is a gift because, again, it's not as sensitive as it was before. So that's really important. I want people to know that healing is possible. You will probably be healing for the rest of your life, and this is a gift. It is a good thing. And then I also want people to, you said about who they are. Please remind me of what exactly the focus was there.
Yeah, I forgot what
Forget that. Forget that and just go with what I'm saying.
it's about to be. I had a birthday. Come on now.
Okay. Happy birthday, by the way.
No,
But
listen, I was saying, this healing, what it's like to be going through this process. Okay, so let me pick up on what you're saying. I was asking you to leave us with something so that when they wake up at 2:00 in the morning, they're, it drives them to ask the question of who am I? And answer that question, because I'm thinking that might be a core piece of how we handle this whole scenario of trauma, getting in, staying in, and getting out.
Yeah, what you said there is so valuable. Answer that question. We will constantly have questions for ourselves. And that's the last thing that I wanted to talk about is the fact that trauma will lie to you. There are several lies that trauma tells. And the number one lie I believe that trauma tells is that you will always be the way that you are.
Yeah.
That you will always be hurting, always be broken, always be harmed, always be in the same situation that you are in. But I am telling you that healing is possible. It's incremental. It happens over time, but healing is always happening. As long as you are alive, you are going towards healing. Your body is trying to heal, to recover, to restore. So know that healing is possible. And when you talk about who am I hope that you have a response for that. But it's not a problem that you ask yourself questions. It's not a problem that you wonder, who am I? Or who do I think I am? To always have a response for whatever the lie is that trauma is telling you, for whatever the lie is that your life circumstances are telling you. Always have a response of who you are. I'm a person who is healing. I'm a person who is whole. I'm a person who is determined. Whatever it might be. Make sure you have a response for what life's questions are.
Yeah, thank you for that, because I think the opposite. If they don't go down that way, they develop what I call the victim mentality. And a person got a victim mentality, put themselves out to be what? To be further victimized and traumatized.
Yeah. And so, and even when I hear people talk about victim mentality, it's just like, that's probably from a place of someone having been victimized, right? And so I want to address the fact that something or someone or some voice in your head is telling you a lie about who you are.
Absolutely.
Make sure you have a response for the question of who you are.
Absolutely. Thank you so much. Would you, okay, so we're going to post our information. Now, do you have anything that you want to tell us about you? Are you doing anything? Do you have an organization? Do you have anything like that you want to share with the folks as we close this thing down? Because, you know, it's impossible for me to believe that you don't have some great stuff going on out there.
Some great stuff. I'm very excited. I just launched a trauma recovery e-course. And so I'm very excited about that. People are signing up for it, enrolling for the trauma recovery e-course. Oh, I have a couple of e-courses on there. One is for trying to figure out, how do I find a therapist? So that's just a mini e-course that's available as well. But the main one is the trauma recovery e-course, where people can, it's self-paced. People can go through it and learn principles about their brain. If the things that I discussed today sparks your interest, you will probably want to learn more about your brain, more about your nervous system, more about what happens with trauma and how do we heal and recover from it. There are over 40 strategies in there that I walk you through as far as trauma recovery. And I also have a subscription service for those who want to join me. When I talk about community healing and communal healing, those aren't just things I talk about. These are things that I do. These are things that I live out for myself as well. And we will be meeting once a month to just have some like group coaching surrounding what we are experiencing on planet Earth, because it's not just like childhood traumas that we experience, right? It's not just something that we experienced in the past. We are constantly facing traumatic things. We are constantly intaking. I just, in your pocket, on your phone, like there is trauma that you just, if you open it up, you can see that there's somebody, you know, a child who's, I saw somebody talking about it today, like their teeth chattering because they lost their mother, because they're, you know, being bombed out of existence on the Gaza Strip. Like the fact that we are even aware of these things, we are constantly facing traumatic experiences. And so just being able to come together as a community and figure out, how do we deal with life on planet Earth? How do we deal with the fact that capitalism is pricing us out of groceries and housing? Like, how do we deal with this stuff? How do we cope as a society? How do we deal with the fact that, yes, women have PTSD more often than men? Women are diagnosed with PTSD. And because of that, there's probably less funding for women, because society perhaps does not place as much of a care on providing care for women, right? And how do we deal with all of these things that we're having to deal with that you have mentioned briefly in this time that we've talked together? How do we manage? How do we cope? How do we have some resilience and recover from these things? So all of those things are available on the site. If you go to drdknight.com, you can find it. But also, I think you have the link available in your, you'll probably have it in your description somewhere. I will make sure that I put it in my Facebook page as well. People can connect with me online. And those are wonderful ways to be able to progress with whatever healing you're wanting to do in your life.
Thank you so much, Dr. D. I thank you. I really do thank you. And here's what I'm taking away is healing is possible, and it is ongoing. You did not say I am healed. You said
healing.
Healing.
I will be healing till the day that I die, and that is a gift.
Yes. Listen, I thank you so much.
Thank you. Thank you for having me. I was glad to be here.
Thank you so much. It's wonderful. Thank you. Go in the back room there, hang out for a second. And there you have it, folks. Dr. D. Dr. D. Oh, what an amazing time we had tonight. She just unloaded on us about trauma. And I know from the little bit I know about trauma, okay, not as much as she knows about trauma, but little bit I know about trauma, she didn't tell it all, okay? I mean, she got a whole bunch of stuff. Listen, why don't you go check out her e-courses? Go check it out, and you know, you will learn a whole lot about who you are, because she's got this course, you know, Dr. D's e-courses. Please, trauma recovery, how to choose the right therapist, and so on and so forth, going down through there. Please go and do that. You're not doing yourself a favor. You are creating healing. That's what you're doing, okay? So do that for her. Thank you all so much. And again, I want you to like, subscribe, share, follow, do all of those things. And please post this one over and over and over again, because the information was just so substantial. Okay, you really need to do this and make some of the information become a part of your life. Have a lifestyle change and make this a cardinal piece of who you are going to be from now on. Like, follow, share, and subscribe. Thank you. Thank you for just hanging out with us. And if you would like to be a part of the show, if you'd like to be a guest on the show, please contact my staff, at drkitspeaks@gmail.com. We'll be sure to get you on. And And we look forward to it. Remember, it's not what you look like on camera, it's what you say. That's important. It's not what you look like off camera because we can't see you. It is what you say to those who need to hear something from you. So say it. If you don't say it, it was not said. Have yourselves a good night. God bless you. See you on next Monday. Have a good evening. Bye-bye.